think today what I'm going to be doing is really covering a lot of the research that we funded starting last year in June up until some of our current and future activities. So I'll run through this relatively quickly. Obviously, some of the things, the reason that we're here and the reason I'm talking about that is because of the identification of PED back in May of 2013. We did have our first diagnosis of it in the United States. Subsequently, when retrospective analysis was done on samples, we know that the virus was here, at least in several sites, as early as April, mid-April. And so that kind of started off the efforts. This is a new virus in the United States. We had absolutely no information about what is the pathogenicity, what is the survivability, etc. So that really kicked off an effort by the Swine Health Committee to corral and identify what are the needed priorities. And that's really been an ongoing effort since June of last year. I do want to mention that this has been an extremely coordinated effort, so I don't think any one of us, one of our groups as stakeholders, has been working in sole concert alone. This has been a coordinated effort with a lot of input from a lot of people. So with the American Association of Swine Veterinarians, United States Department of Agriculture, state veterinarians, National Pork Producers Council, ourselves National Pork Producers, National Pork Board. So a lot of people have been involved with this effort, both of managing PED, the research perspective, and even selection and identification of research needs, especially the non-labs too. That's been a huge part. Obviously, PED is still a huge challenge for us right now in the United States. We do have over 4,700 cases identified, and we get a lot of media calls wanting to know how many farms is that, and I don't have that information. All we know is that it's a case count from the actual non-laboratory, and it may be a single case, it may be a new case, it may be a recurring case. So all that case count is just that, a case count. We do know there's currently 28 states that have the virus identified. Vermont was newly identified yet this week. All that information, the American Association of Swine Veterinarians will post on their main site at aasv.org, and that is updated as Harry gets that information as well. And like I said, I bring that up from a media perspective because that's probably one of the most predominant questions we get. How many pigs are affected? How many farms are affected? And unfortunately, I don't have answers to either of those. So, what has our focus been? Obviously, since PED was new, we needed to find out pretty much everything there is to know about the virus. But we had to start somewhere. So really, we wanted to look at research, and then from that research be able to develop communications, producer outreach information, because a lot of people are asking, what are the guidelines for dealing with this virus? What are biosecurity things we should do? How do you kill it? How do you control it? So we needed to get that research done to have the next step of the producer outreach information and communication. And then finally, as we learn more about the virus, that dovetail into containment and management strategies. Because again, if we don't know very much about the virus, it makes it near impossible to be able to figure out how to go to the next step of containment, management, and even elimination. And so Dr. Sundberg will cover some more of those activities. I just wanted to bring that up as part of the overall review. And so from the research side of it, again, development of our research priorities has not been one singular effort. There's a lot of people involved with that. Predominantly our Swine Health Committee, which is made up of producers, veterinarians, allied industry folks, other advisors from university, government, etc. Those folks are the ones that really are tasked with identifying the proposals to fund for Pork Board, but they all come from a wide variety of backgrounds, so they provide input into the process of what's needed. We also have a PED Strategic Task Force, which is a small group of key people in the industry and government, also university, that helps provide input to us as far as what our activities should be focused on, what are things people are hearing out in the field. Then we can also funnel that information into how we develop our priorities. We also get information from the veterinary groups, so AASV as well as National Pork Producers Council, and then state pork associations also provide input. That's a very simplified list because there are so many other people that we are in contact with on a daily basis, but those are predominantly the areas that help develop those priorities and get that research identified and then completed. So back in June of 2013, again, we were really at the point of needing to understand what are the basics behind this disease. So some of the things that we obviously really needed to learn was the basic pathogenesis. What does the virus do to the pig? How long does it survive in the pig? How long is it shed? Is it viremic? Is it not? Those basic questions. Then we also needed to continue to develop and validate diagnostic testing. We obviously had some to look at the PCRs, so to look at the actual RNA of the virus, but we at that point in time did not have any ELISA tests or serologically based tests, so we needed to undergo that as well. We didn't know environmental stability, so whether or not this survived in water, in manure, on wooden surface, metal surfaces. So we essentially had to look at basic survivability timelines and curves. And then also gather other epidemiology of the disease. How was it transmitted? Is it associated with a particular risk factor? Where was it moving? How is it moving? Is it airborne? So all of those things we really wanted to fund. And that was something that we identified back in June of 2013. There was 8 initial proposals that were funded for PED on those specific areas. And so the committee moved forward. Now, one thing I can say, for any of you that are involved in our pork board research process, it's a relatively long process. Normally, when we send out a call for proposals, it takes a couple weeks to get those proposals back. We get them internally. We will send out to the research and scientific community for scientific reviews. That typically takes another 4 to 6 weeks to get that done. Then we get those review back. In a couple of weeks, the committee will decide on proposals. So from the time where we solicit for calls for proposals to when we actually select those can be upwards of 4 to 5 months, depending on which time of year we get that done. There's a lot of things. We had a lot of internal discussions at Pork Board and realized that that timeline really wasn't going to work, because when the disease hit, you guys all know it hit us very, very quickly and spread very quickly. So we really needed to alter our approach to research and say, okay, we need to be more mobile, we need to have a lot more response. So this initial call that we did in June, we essentially got the priorities developed, sent them out as an RFP. Within a week's time, we had proposals back. We had about 2 or 3 days right over Father's Day to look at those proposals, and then that following week we selected them. So from the time where we got the call for proposals out to where we funded those was less than 3 weeks' time. And these all proposals were in under a 6-month run. And so normally in our proposals we allow between 12 to 18 months for complete project completion. This time we told all of our researchers up front, hey guys, we really need to have this information back quickly because our producers are struggling. It's very important that we support the producer community and veterinary community by having this information in an expedited manner. And so that all went off without a hitch. The other thing that we asked for is to have intermittent updates on a bi-weekly basis, because we wanted to have that information we could send out to people. So if we knew something about survivability, every other week we would try to publish that information, and all of that has been available online. So this is a completely different research process than what we have done before. Well, we got a lot of our research done early on and realized, okay, now what do we need to know? So after World Pork Expo, we had Layman Conference coming up. We had a lot of producers and veterinarians together, and we realized there's still a lot of gaps in our knowledge. So this fall of 2013, we were having people now doing feedback on animals, trying to get these early farms calmed down. And we had a lot of reports that there were some problems with trying to build immunity on farm and trying to understand and learn how is this virus working in the sow herds and how do we potentially get rid of it. So things that we were looking at really focused in on sow immunity. How is immunity developed? How do we measure that? What level of immunity is needed for piglet protection as well as adult protection? And even the basics of what is the duration of that immunity for the virus. And those are things that we just didn't know at that time. We also needed to have diagnostic tests that could assess serologically what the virus was doing within the animal, because up to that time we only had PCR testing. So we needed to look at ELISAs, the IFNs, or even some additional experimental tests. So all of that got underway. This particular call was also done on an expedited basis, but because we're looking at sow immunity, a lot of these proposals have a longer timeline for completion. We're still in contact with the researchers about getting updates, but some of the sow studies, and really in order to assess duration of immunity, are taking some time, more so than 6 months. But again, we are working with our researchers to try to get information out there as quickly as possible. So that kind of rolled out the end of 2013, is really assessing what's going on in the south side. Now, right at the tail end of the year, we started having some more discussions about feed quality issues. Is the potential for PED to transmit in the feed or plasma, is that something we need to look at? That was a question really since the summer, because AASV did the initial epidemiologic survey on the farms, and really one of the risk factors that was highlighted but not necessarily confirmed was the ability of feed to transmit the disease. So it just let us know that that was a risk factor, but it really didn't say yes, feed was the primary vehicle for infectivity of the virus or transmittance of the virus. So at the tail end of 2013, we also had several proposals that were looking at how can the virus transmit in the feed. And so there were several just small benchtop projects that were done. At that time, none of those trials proved that we could have a spreading of the disease via feed, and that was typical dry feeds. So that kind of wrapped up what we were looking at for 2013. At that time, at the end of the year, we had just over $1 million, about $1.1 million US dollars that went towards funding PED research. And so our board had approved that throughout the course of the year. We had utilized existing Swine Health Committee funds, but that's where we were at for 2013. So as we got into 2014, we had a general call out that was started in October. We looked at proposals and selected those back in February. And again, the call language that we had developed at the tail end of 2013 was focusing on validation and continued development of diagnostic tests for a variety of reasons. Again, serologic, genetic, and also just identification of the virus. But we also added the point of being able to continue to track and monitor changes in the virus and changes in transmission. Are there new things that are happening? So we really were focusing on how do we improve our surveillance for this virus. And then lastly, looking at the efficacy of disinfectant. That was something else that we really needed to look at, because a lot of questions were coming up. You know, what products have data for disinfection, what don't, and what can we do about that? So as of spring of 2014, we did fund 3 projects that covered those 3 areas, and that was another $150,000 that we had, the board had approved and the committee had approved so far in 2014. So those are all new. We don't have any data on them yet. So now what? As we look even further in the year, obviously our strategic task force meets. We had our American Association of Swine Veterinarians annual meeting. So from that meeting, there were still a lot of questions on PED, and I think there's going to be a lot of questions. However, early on, Dr. Sundberg worked with our board, and at our March pork forum, the board approved an additional $650,000 for use for PED activities, both including research and communications efforts. So we knew we had that pot of money right now to start us out for 2014, in addition to what we had already spent in the springtime. So feed still continues to be a prime issue and one of concern. There's been several reports from the feed industry, even from Canada when they were first identified as looking at other feed and feed ingredients and feed systems as potentially being more of a link to actually PED transmission. So on March 19th, Dr. Dave Pyburn and Dr. Paul Sundberg had all gathered a lot of people together from the feed industry, from the veterinary community, from the research community, to really discuss and line out what do our feed priorities need to be, and have that down to answerable questions that we can focus on, because we really needed to get through this issue and try to put it to bed. What's going on, where are risks, and how do we mitigate those risks? So it was a very productive meeting that led to the development of our priorities. At the same time, I've been working with David Bailey and Dr. Heiss from Genome Alberta, who are working on a collaboration within Canada to look at some additional PED research priorities. That group has, at least we know, about $500,000 for research. We're working with them closely to be able to leverage funds from both countries to really cover this broad needs for PED. And so we'll be finalizing our work on April 10th and having additional calls. But for the feed RFP, these are, I don't expect you to read all of them, but really it's looking at conducting feed risk assessments. Where are the points of risk within the feedstuff, feed transmittance, and feed systems process that can lead to risks for PED? And so we're not saying it's one area or the other, but looking at the whole continuum of this process. What's going on? What are our risks, and how do we address those? The other one is looking at virus survivability, because the question has come up, if we do identify feed as being a method for viral transmission, are there mitigation steps that we can take? Is there a hold time? Are there certain compounds that we can utilize that can also, have an impact on virus survivability? The other thing that has also come up, we're looking at PED right now as a domestic disease, but what if this had been another disease? So, for example, foot and mouth or African swine fever. Dr. Ferguson will cover some risk pathways assessment for that. But we felt it was important to be able to look at, are there other diseases that can serve as a surrogate for some of these foreign animal diseases that might be a little bit easier to deal with, to handle, to propagate, that we can use to look as a feed model. So that's another point that we're trying to evaluate. Some other priorities, we're really looking at the feed mitigation part on viral survival, but also developing a viral dose curve. We did some initial assessment on virus survivability and dose titration, but that was really in live animal. That wasn't necessarily looking at feed as a component. So the group thought we needed to really assess, is there a certain level that the virus has to be present in order for it to be viable or not? So that's something that came up. And then lastly, looking at diagnostics to help determine the potential of a virus to be infective or not. One of the things we struggle with this virus is to have a way consistently to be able to do a bioassay. We get a positive PCR result, but then how do you know if that PCR result means the virus is alive or the virus is not alive? From our feed assessment, the difficulty we've had is being able to take a sample with a positive PCR and then trying to put it back into a pig to prove that the virus is infected. And that's where we've gotten a lot of conflicting results as far as the survivability. The virus is very fastidious. It's got to have very specific requirements for growth. There are cell-adapted strains that can grow in cell culture, but they may or may not mimic the pathogenicity of the field strains. So, that's something that we're looking at too. Are there other alternatives that we can utilize? Is it a genomics approach? Is it a diagnostic approach? Something that we can utilize that can help us better answer the question of infectivity of that virus versus just having to go back and putting it constantly back into a pig or that type of bioassay model. So that priority is we have it for feed, but we're going to have it as a broader perspective too, because I don't think this is going to be a quick issue that we're going to be able to identify and address, so that's going to go out also in a broader call. So our feed priorities, again, to give you a timeline, we sent the priority language out March 25th. Proposals are due back to us tomorrow. Dr. Dave Pyburn's back at the office working on those. And then our Swine Health Committee is going to have a pretty expedited review timeline, and we'll be looking at those proposals to select basically on Friday. Again, we have visited with the research community. A lot of those folks were at the meeting on the 19th, so we're aware and prepared for this call. So we hope to get some really good proposals. We'll see what we get, and we can keep everybody informed. So what are the additional needs and what's next? Well, since that time that we've identified PED, we've also identified several other, at least one other virus. There has been variants of the PED strain. We're trying to work through what this means because there are some genetic differences, and so a lot of different researchers and universities are really trying to better understand what that means from a PED standpoint. However, there is another virus called swine delta coronavirus. It is a coronavirus, but it's a delta corona, PEDs, and alpha corona. So we're trying to assess what does this mean, and really going to assess swine delta as another pathogen. So looking at having to do pathogenicity studies, potentially looking at our diagnostic needs, a lot of things like that, again, so we can also apply the same mitigation measurements and management measurements to swine delta that we do for PED. We are looking at having an expedited turn specifically on swine delta because that is kind of a segregated issue. We want to make sure that we do have stuff focused on that. We did work with all of the NIAA laboratories that are in the major swine states, kind of sent out a very quick survey and got information back of what they perceive as needs and some of their struggles dealing with the virus. So we're utilizing that information to be able to help guide us in our research needs. And so that's where a lot of having that coordination and having those NIAA laboratories really is a big help, because we have that network of people we can contact to reach out in instances like this and say, hey, what do you guys need? How do we help? And try to work that all in. Lastly, we are going to be doing another PED, kind of an animal-focused call for proposals. I've got those timelines listed. Really what we're trying to look at is how do we continue to address the live animal or animal-centric issues with PED. And that may be continuing to reassess what our sow immunity is doing, looking at mitigation measures both from a trucking and transportation standpoint. We have feed covered, but it may be additional diagnostic information. How do we look at sequencing, assessing the genetic changes and variability? So all of those things we'll be addressing in a separate call here in a couple of weeks. So there's 3 different things: the feed RFP, the swine delta, and then regular PED for animal issues. So those are all ongoing and underway. All of the information that we have and that we will generate from these newer calls as well are located at our website at pork.org/PED. Again, we're going to be doing some revamp on the website as it is, because it's got most of the 2013. So we'll be working to try to highlight more of the 2014 data and things like that. But all of the information, as far as at least the title of the project and the university where it's being done, will be posted. We still are not publishing everything because we understand that the researchers still want to be able to utilize this information for peer-reviewed journals, but they are providing us information on these projects as they can, and so everything that we can publish, it will be out there publicly available for anyone to view. So just a brief thing on our communications and outreach, because of generating this information, we really wanted to make sure that it hits the producer audiences. So different things that have happened. We've done a ton of news releases. We do like a bi-monthly PED update newsletter specifically on things that are going on within the PED sphere. Within some of our internal documents, our Pork Insider and Pork Leader magazines, we've sent those out. We have a bi-monthly research review that covers all of our research. Those go out via email, through our checkoff magazines, newsletters, numerous media reports and things like that. This number, the 434,000, is probably quite a bit shy right now, just because that was done towards the tail end of last year. But really trying to make sure that we get a coordinated effort, get this information out to all stakeholders, and it's not just producers, but a lot of people can have access to this information. And so the thing is how do you convert research information into usable information? Those of us in the geek sphere really like to see the scientific stuff, but it does not translate well when you're really trying to deal with, how people are going to handle the disease. So what we're doing is taking a lot of these research results and putting them into usable formats of different things. So for example, we have a whole task force group that really looks at what's needed, what are producers asking for, what do veterinarians need for support, what does the show industry need for support. So we're utilizing a lot of our knowledge that we've gained from the research and putting it into usable formats for people to have. And so again, very collaborative effort. We've tapped into a lot of people to really say, hey, does this make sense? Is this valuable? Because if it isn't, we'll toss it and go to something else. But if it is, can you help us develop it, what would really be most effective and for use? And so some of the key things early on, we did PED Transportation Guidelines, because a lot of people were saying, we don't really have a resource. How do we wash trucks? How do we manage our truck wash stations? What do we need to do for heating and treating? How do we need to keep, other vehicles from getting contaminated? And so we put out a variety of different guidelines in a very simple fact sheet format, usually 1 to 2 pages that people can have. They can download it. We have hard copies, but that information is out in the public sphere. Same thing with manure hauling. At the time that we were looking at this, we were starting, in the summer. Obviously, summertime is the spread season because you want to get nutrients out on the ground. But then also into the fall before ground freezes, you want to be able to do at least some manure application. And so as we learn more about survivability, we were asked, can we develop manure guidelines? How do we affect the people that are contracting doing this? How does this affect landowners? How does this affect producers who are working in the buildings? So we worked with a lot of our stakeholders to develop some basic guidelines on manure handling. And that came, again, based on resources. These are just some other examples of other resources that we have still being completed. Our non-production staff biosecurity guidelines, because that's come up with people doing audits or DNR inspections or any other kind of inspections where people aren't normally part of the day-to-day production. What do they do? So we have that coming up. We've been working closely with packers and processors to have their own specific guidelines. But then also the show industry has been very, very interested and concerned about this disease. So we've worked very closely with a lot of folks there saying, okay, how do we support exhibitors? Because obviously we want to have, we don't want to stop that because that's where we build our youth, and develop interest in swine production. And so we work closely with exhibitors and organizers on developing biosecurity guidelines. And then most recently we have one on taggings and weigh-ins. Kind of ran that through our working group because we were coming into spring. A lot of people are gearing up for shows, for sales. And so we wanted to have some basic information out there that people can utilize. So those are all the things that we have. We have them both in a book format or individual fact sheets. If you guys want any of that information, let any one of us know. We'll get that to you ASAP. But there's a lot of stuff that's out there. And like I said, this is not something we've done alone. It's been a huge effort with a lot of different people. So just to wrap it up, both PED and swine delta corona are two obviously new diseases to us in the swine industry. We needed to act quickly and decisively on this, at least from the research standpoint, because there was a huge gap in our knowledge. We just didn't know how to manage it. And so I think we've had a good course of progression for research. We've laid out our future progression. We'll continue to work with our stakeholders on key questions and gaps in knowledge, and then also make sure everything that we have is made available publicly for people to use. Our continued cooperation, collaboration between all sectors of the industry within our government universities is essential, because without this, we would not have been able to be where we are today. And we're going to continue to need to look at that and to work together, because I'd love to say this may be the only disease we'll find. However, I'm not confident, because we've had things such as Kubo virus show up. PCV, we saw that a couple years ago. PED right now, hoping that we won't ever see the other nasty ones. But this is something that helps gear us be prepared for the next time. And then again, we're just going to continue to focus our efforts on cooperation for key research, collaboration, and just continue to work on this for PED management and control.